Well, hello and welcome to this edition of the Lynne Hayes Freeland Show. You know, I feel like over the last 14 months, I wish I had a calendar that I could look at to see how often we talked about the virus, the vaccine, the Black community. I have no idea how many times we've had this conversation. The difference is we're always advancing the conversation, and that's exactly what we're going to do today. My guest today is Dr. Rhonda Moore Johnson. She is a retired physician and current healthcare consultant here in the Pittsburgh area. She's kind of become one of our go-to people when it comes to the virus, the vaccine, and the Black community. I thought it was good to take an update. You know, we're a couple months into the vaccine now. It's been a while since we talked to her. Welcome back to the show, first of all.
Thank you, Lynn. Always a pleasure.
And how would you assess like the state of the virus/vaccine in the Black community today? How would you assess that?
Well, I would say it's got mixed reviews, but I always like to start off with the positive as opposed to looking at the bad. So the good versus the bad. So if you allow me to go back to the beginning, to November 2019, this virus came on the scene out of nowhere. We're still not sure where it came from, but Wuhan, China, not a single person in the human race, the entire human race, had no immunity to this virus. We were all fully susceptible. And that's why this virus has gotten the upper hand that it has had, because not a human person on earth had immunity. So this virus had unlimited opportunity to infect us. And so we've seen the calamities across the globe, different countries, different times. And 2020 was a year of incredible suffering in terms of this pandemic. Here in the United States, you know, when you look at our numbers, we've lost over 500, almost 600,000 people have died in this country alone. And we are now at a point where we have a weapon, literally a weapon, to halt the progression of this virus. Worldwide, we must look at it because it's a global pandemic. We have, in a very short period of time, you think about the Pfizer vaccine, was licensed for emergency use in December. And shortly after that, within days, the Moderna vaccine, the Johnson & Johnson vaccine was licensed for emergency use in February. But look at the progress that we've made. Over 1.1 billion people worldwide have had at least one vaccine against the COVID. That means 1 billion people now have an opportunity to defend themselves against this virus. Here in the United States, we've had over 248 million people who have had shots in their arms, and at least 95 million people who have been fully vaccinated. That is a lot of progress, and most of that progress has occurred since December of 2020. So in a short 3 to 4 month, now it's 5 months because we're into May, we've done an incredible job getting vaccines in arms, and most importantly, in the most vulnerable people, because most of the deaths in year one of this pandemic occurred in people who were 65 years and older. Now that group is fully immunized. Deaths have drastically decreased in our senior and our elderly population. Now we have new opportunities. The opportunities, of course, are to get our young people vaccinated and our children vaccinated. So that is the progress.
Let me jump in there for just a second, because you mentioned our children. And I'm guessing, and so full disclosure, we actually record this show on Wednesday. You guys see us on Sunday. So there's a very good chance between now and Sunday, there will be a green light for children between the ages of 12 and 15 to get the vaccine. Yes. What are your thoughts on that? Because there are some adults that aren't sure what they think about themselves. let alone their kids.
Right.
But again, this has been fully vetted, fully researched. It's not just like some people say a crapshoot.
Yes. So, Lynn, you know, I'm a pediatrician by profession, and I practiced primary care pediatrics for a little more than 20 some years. So, I look at what has happened to our young people over the past year. Our teens, you know, they've missed out on graduations. They have missed out on in person classroom learning across the United States. They've missed out on after school activities, sports, band, orchestra. You know, they've missed hanging out with their friends at the mall. They've missed birthday parties. They've missed ice hockey. They've missed going to sports events, and this has created a mental health crisis for our young people. The social isolation has been very difficult for them. So now we have an opportunity to get this next age group, because, you know, let's remember that the Pfizer vaccine is approved under emergency use authorization for 16 and up already. Moderna is approved for 18 years and up. So Pfizer has done a clinical trial where they've had, I'll just say 2,300 almost, teens between the ages of 12 to 15 enrolled in this clinical trial. And what they have found is that this vaccine was extremely effective in prevention of COVID infections, just like it is in adults. And the safety profile was very similar. The side effect profile is very similar to adults. Most of the teens just had soreness in the arm, you know, a little bit of fever, headache, feeling fatigue, the exact same side effects as adults. So the Pfizer has its data before the committees of the FDA, the expert advisory committees. And if they say go, we heard President Biden say yesterday, it will be immediate. And what's good about this vaccine rollout is that kids can get the vaccine in the doctor's offices. So pediatrician offices are going to be able to administer these vaccines. And that's been a little bit different than the adult rollout because, you know, a lot of those occurred in these mass vaccination clinics, pharmacies.
Sure, any place they had a lot of tables and chairs.
That's right.
Stop for just a second. We're going to take a commercial break. This has all been great news. Everything you've outlined is exciting, at least for me, for sure. But we also know there's still a hesitancy that exists in our community. We'll talk about that next when the Lynne Hayes Freeland Show continues, so don't go away.
Okay.